Now, of course, it's absolutely essential that blood can clot when blood vessels are damaged. If the wall of a blood vessel is damaged, the blood's going to start leaking out, and we need to stop the blood from leaking out. We need to prevent hemorrhage. So blood clotting is an absolutely essential process to prevent hemorrhage. We want the blood to be in the heart and in the intravascular compartment. We want it to be in the heart and the blood vessels, and we don't want blood anywhere else. We don't want it leaking into body spaces. We don't want it dripping out onto the floor. We need it to be where it is. So if a vessel is damaged, it's absolutely vital that coagulation can occur to plug the hole in the blood vessel to stop it from leaking. So, for example, if someone has a hemorrhagic disorder, such as haemophilia, then they can bleed to death from a simple cut or from a few bruises. They get blood leaking into their joints, causing excruciating pain. Absolutely essential that this process of blood clotting happens. And this, of course, is completely physiological. This is absolutely normal that blood clotting takes place. It's a physiological blood clotting. But sometimes blood can clot inappropriately in the wrong place. And particularly, blood can clot inside the blood vessels. Blood can actually clot inside the heart sometimes. It can clot in the arterial system, and it can clot in the venous system. So there could be arterial clotting or venous clotting. And blood clotting we call thrombosis, from the Greek word for clot. So we can have an arterial thrombosis in the arterial system, or we can have a venous thrombosis in the venous system. Both of these are completely pathological situations. It should never happen. It's abnormal, it represents a disease process, it's pathological. And as well as that, when a thrombus is formed, bits can break off and float along in the bloodstream, and that's called an embolism. So thrombus and embolism are both pathological situations. But it starts off with that blood clot in the vessel that forms where there should be no blood clot. This pathological thrombus formation. So what are the factors that predispose to thrombus formation? Why does this sometimes occur? Why does it occur sometimes in veins? Why does it occur sometimes in the arterial system? What are the factors that lead to blood clotting? And there's three main groups of factors that can lead to blood clotting. And these are described as Virchow's triad, from Rudolf Virchow, the famous German pathologist. So let's look at these three factors now, and we'll see that these have got immense significance, both in how we advise our patients to prevent blood clotting from occurring pathologically in the vessels in the first place. Very important for health education and preventative treatments and preventative advice. And also very important when we come to treating the conditions, because these conditions are life-threatening, or they certainly can be life-threatening, and we need to recognise them early, we need to treat them early, but that depends on the understanding we're going to go on and look at now. Now here we see these three factors first described by Rudolf Virchow way back in the 1850s. I think he first published this in about 1856. So it's called Virchow's triad. Now we see that there's three factors that lead to the formation of thrombosis, these pathological blood clots that occur inside blood vessels. Whether it's arterial or venous, these three factors would still be the same. So what are these factors? Well, the first one is probably fairly obvious. It's increased coagulability of the blood. So if the blood is more likely to clot, generally, then the blood is more likely to clot inside a blood vessel. This is why we give anticoagulants sometimes. We make it harder for the blood to clot, to prevent thrombus formation. But if there's increased coagulability of the blood, then that's going to make the thrombus formation more likely to occur. And of course the blood is running through the blood vessels, and the blood vessels are lined with vascular endothelium. So the blood is in direct contact with this lining of the blood vessels, the vascular endothelium. So if there's disorders of the vascular endothelium, that can also stimulate clotting, can also stimulate the coagulation cascade, and that too can lead to thrombus formation if there's something wrong with the vascular endothelium. And the third factor in Virchow's triad that can contribute towards the development of pathological blood clots inside blood vessels is sluggish or abnormal blood flow. So if the blood flow is particularly slow or sluggish, or indeed if the blood flow is turbulent and it's cascading through the vessels pathologically, that can also give rise to thrombus formation. Thrombosis is the condition. A thrombus will be formed in the condition of thrombosis. So these are the three interacting factors of Virchow's triad. Very often they do interact, but other time a blood clot can be formed primarily by one of the factors acting in isolation. Let's think about now what a blood clot actually is. So in the blood we have small soluble molecules called fibrinogen. It's a protein. And when this is appropriately stimulated as a result of stimulation of the coagulation cascade, this fibrinogen all comes to clump together. So it goes from being soluble fibrinogen in solution in the plasma to insoluble long sticky strands of fibrin. And we get precipitation of the fibrinogen forming these long sticky strands of fibrin here. And they stick together like this because they're long and sticky strands. So basically what we have now is a net that's formed here in the lumen of the blood vessel, in this case if it was a thrombus. Of course, this is what would happen if there's a hole in the blood vessel. It would be the same thing. It's the same process. It's the blood clotting process. And then because this is sticky, the red blood cells are going to come along and they're going to stick into these strands of sticky fibrinogen, which have become fibrin. It's now fibrin. So the red blood cells are going to stick onto this. There'll also be some agglutinated platelets that are sticking here as well. So there's going to be, remember the platelets, the thrombocytes, they're also going to be here. And then there's going to be other blood cells as well. So there's going to be some white blood cells as well that are also going to stick to this overall clot here. So there's a lymphocyte, there's a neutrophil, here's a monocyte. They're also going to stick to that. And any debris that's around will also stick to that as well, forming a clot. Now, of course, if there's a damage to a blood vessel, so if there's a blood vessel here, and it's been cut like this, there's now a hole in the blood vessel. This is exactly what we want. This agglutinated, sticky fibrin precipitated out from the fibrinogen. And we want everything stuck on it, forming this clot that's going to plug the hole in the vessel. Exactly what we want. It's going to stop the bleeding, so the blood's going to stop coming out. That's what we want. But in the pathological situation, this can happen in a vein. So suppose this was one of the deep veins of the leg here. Then we could get a blood clot forming. Very often, remember in veins there's these valves, these structures that ensure one-way flow. So the valve would be there like that. And the purpose of the valve is to allow the blood to go from there to there, but not from there back to there. Well, blood clots can sometimes start forming around about there. That would be the site for thrombus formation in a vein. We get this thrombus formation. And it's surprising how much these can grow. They can actually grow and become really quite extensive long blood clots in the vein. So that will be a thrombus in a vein. And of course parts of this can break off like that, and if it's broken off, it's just going to be washed in the flow of the blood. So if it breaks off, it becomes an embolism. This condition is embolism. That is an embolus, and several emboli may be formed, and they will just flow along in the flow of the blood just passively if they break off. So the thrombus is the blood clot where it formed, and emboli can break off that and travel to other parts of the circulatory system. So that could be a thrombus in a vein, but there can also be thrombus formation in the arterial system. So here we have an artery, and arteries are going to branch into smaller arteries. And the most common cause of thrombus formation in an artery is the development of the disease process called atherosclerosis. So atherosclerosis is the formation of atheromatous plaques in the vessel. So over years these fatty atheromatous plaques will form. Smoking, poor diet, lack of exercise, metabolic syndrome, diabetes, obesity, hypertension. You probably know some of the risk factors for the formation of this atheroma. And the atheromatous plaques are supposed to have a cap on them. They actually have a cap going over the top of them. But if that cap breaches, if there's destabilization of the plaque, then what will happen is that platelets will come into contact with the inner core of the plaque just here, and this is thrombogenic. It will initiate thrombosis. So we start getting platelet formation here. Sometimes it just stays as platelet formation. That's what we call white thrombus. But this too can embolize, and it will go along in the arterial flow and can cause problems downstream, where it blocks they can block in smaller vessels. But other times the platelet aggregation, the white thrombus, will lead to the full initiation of the coagulation cascade. That will cause the fibrinogen to be converted into fibrin, these sticky strands, and the cells will stick to that, and that can cause a complete blockage of a vessel. So thrombosis can cause a complete blockage of a vessel, and of course that will result in absence of blood supply to the tissue normally supplied. This area of tissue will lose its blood supply, and we will have an infarction. It will infarct. So basically we've said the blood clotting can occur in three situations. The situation where we want it to plug a hole in the blood vessel to prevent hemorrhage, but it can also occur pathologically in veins, and it can also occur pathologically in arteries. And we've seen that the factors that predispose to this are increased blood coagulability. So in both cases, the more likely the blood is to clot, the more likely the thrombus is to form. We've seen there can be disorder of the vascular endothelium, and here we've seen disorder of the vascular endothelium. In the artery, it's the atheromatous plaque, but there can also be disorder of the endothelium in veins as well, such as might be caused by infection or physical damage to the veins. And then we've also seen that the thrombus can be caused by sluggish or abnormal blood flow. And we've noticed that the blood flow as it goes past the atheromatous plaque can be abnormal because it has to swirl. So if we think about an atheromatous plaque just here, so there's the vessel, and here's the plaque of atheroma sticking out into the vessel lumen. So this is the These grow with time, of course. So that's the vessel lumen. So for the blood to get past here, I think you can see it's going to have to swirl round there, causing disordered blood flow, which also predisposes to thrombus formation. So sluggish or abnormal blood flow is the other factor there. And sluggish or abnormal blood flow is particularly the risk factor in the development of venous thrombosis. So if there's immobility for a period of time, as might be caused by injury when the patient is lying still for a long time, or as might be caused by surgery when the patient is immobilized on the operating table and probably won't feel like going for a walk straight after the operation either, or someone who's on a long haul flight or sitting in a car for a long period of time, or working immobile at an office desk, then there's going to be sluggish blood flow, because the blood flow through these deep veins depends largely on the contraction of the adjacent skeletal muscles. And if we're sitting still and not moving very much, then there's going to be less coagulation of these muscles. The blood is going to flow through the veins more slowly, giving rise to sluggish circulation. So it's a very neat way of classifying it that Virchow came up with there. And we can normally identify these three factors. Is it caused by increased blood coagulability? Is it disorder of the vascular endothelium? Or is it sluggish or abnormal blood flow?